So first I'm going to wash my hands. Hand hygiene is an important part of infection or preventing the spread of infection. All right, hello, my name is Nicholas Austin. I'll be your nurse for today. Can you give me your name and your date of birth?
Zachary Austin, 11/23/98.
All right, great. So today I'm going to be conducting a physical assessment on you. It'll take about 20 minutes. If you have any questions, feel free to ask at any point. Any information I get from the assessment will remain confidential and private between us. So first I want to start with the mental status exam. I'm going to give you 4 words. Please remember them. I'm going to ask for them later. The words are dog, tree, bucket, and red. All right. So the client's posture is appropriate, relaxed. He's sitting on a couch. Body movements are smooth and equal on both sides. The client's dress is casual and clean. The client is well groomed with proper hygiene. And let me look at your pupils for a second. All right, his pupils are equal, round, and reactive to light. Can you give me your name again?
Zachary Austin.
Where are we?
Our house.
Can you tell me what time it is?
Around 9 p.m.
Okay. The client's facial expressions are appropriate and change with conversation. The client's speech is fluent at a regular pace, has a slight accent. How do you feel right now?
In a good mood.
Okay. I would say his affect is calm and that his mood and affect are pretty congruent. The client is awake, alert, and oriented to person, place, and time. The patient can focus on one idea at a time without wandering, or is not easily distracted. Can you tell me what you ate yesterday?
I didn't eat breakfast or lunch, but I ate pizza for dinner.
Okay. What was your first job?
Nurse.
Can you give me those 4 words that I asked you for earlier?
Dog, tree, bucket, red.
Okay. What would you do if you found a stamped envelope on the sidewalk?
I would try to deliver it to wherever it needs to be delivered to, or to whoever it needs to be delivered to.
All right. I'd say your judgment is fair. The client's thought process is logical. The content of the client's thought is also logical and consistent. How do people treat you?
People treat me well.
Do you ever feel like you're being watched or followed?
No.
How is your imagination?
Generally active.
Have you heard your name alone?
No.
Do you feel like life is worth living?
Yes.
Have you ever tried to hurt yourself in the past?
No.
Do you have any suicidal thoughts right now?
No.
Okay. That's the end of the mental status exam. Now I'm going to get your vital signs. Are you in any pain?
No.
So on a scale of 1 to 10, you'd say that your pain is a 0?
Yes.
Okay. Do you know what your blood pressure normally is?
About 120s over 80s.
Okay. 120 over 90. Alright, so now I'm gonna check your heart rate. Alright, pulse is strong at 80 beats per minute. Your respiratory rate was 20 per minute. So now I'm going to get your temperature. Pull your ear back a little bit. Alright, your temperature is 97, which is normal. Alright, so we take a look at your head. Alright, so your skull is rounded, symmetrical, normocephalic. Your scalp, let me take a look at your scalp. Actually, your scalp is lighter than complexion, dry, no lesions, no abnormal masses. See, your hair is dark brown, evenly distributed, dry, curly, no sign of parasites. The patient's face, the skin is the same, the skin is uniform with the rest of the body, no discolorations, no lesions or tattoos. All right. Facial features are symmetrical. Eyes are the top 1/3 of the face, the mouth is the bottom 1/3 of the face, and the nose is midline. So now we're going to test your trigeminal nerve. So what I'm going to need you to do is to close your eyes. I'm going to tap your face with this cotton ball, and you're going to tell me when you feel it, right?
Yep. 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 Yep.
All right. Shows the trigeminal nerve is intact. All right, so now I'm going to get you to, I'm going to put my hands on the side of your mouth or face or jaw, and I'm going to need you to clench your teeth repeatedly. All right. The client clenching his teeth was strong and equal. So now we're going to check your facial nerve. So can you first raise your eyebrows, lower your eyebrows? Okay, now can you bare your teeth? Can you smile broadly? And then can you puff out your cheeks like, okay, that's good. The last part of this is, I'm gonna remove your glasses for you for a second. I'm gonna need you to close your eyes, and I'm gonna try to pull them open and just resist it. Do another one. Okay. There's your glasses back. It shows that the facial nerve is intact. Facial features were symmetrical. Alright, so I'm about to move to your nails, but before I move to your nails, I want to do a quick kind of peripheral vascular check of your arms. So I'm just going to kind of feel the temperature. Alright, they're warm. Let me see if I can do your brachial pulses. Yep, they're both strong and equal. Get your radial pulses. That's good, they're strong and equal. It's check skin turner, no tinting. Now let me check cap refill on your nails. All right, that's good. That's a good sign of perfusion. Nail beds are pink. Nails are translucent. They're trimmed. No clubbing. Angle is less than 160 degrees. The skin around the nails looks clean and healthy. The cap refill was below 3 seconds. Let me look at your eyes for a minute. Okay. Eyes, there's no sign of drainage or lesions around the eyes. The eyelashes curve outward and are evenly distributed between the top and bottom lids. Eyebrows are present, symmetrical, coarse, dark brown, and no signs of scaliness or lesions. So now I'm going to, you're going to come with me and we're going to assess the optic nerve. All right. So can you follow me? Let's see. All right, so you stand over there. There's the Snellen chart. Stand by the table. All right, so first, since you have glasses, you can wear them for this assessment. Here's a card. I need you to first put it over your right eye and then to read the smallest line that you possibly can.
LFED.
Okay. Now, can you do with your left eye? Can you move the card over to your left eye?
FECFD.
Okay. And now you can do it without. You can just read whatever line you can.
EDFCZF.
Okay, that's really good. So that's all for the optic nerve. That shows that the optic nerve is intact. So if I was to test for color discrimination, I would use the Ishihara test. The Ishihara test involves using a booklet with these colored plates. In the colored plates, there's circles that have numbers, and basically people tell if they can read the number or not. And if they can't read so many of the first 11 plates, then that's how they tell if they have a problem with color discrimination. So then, now I'm going to test your oculomotor, trochlear, and abducens nerves. I'm going to do this by using the 6 cardinal fields of gaze. So I want you to stare at the pen and just try to follow it with your eyes. All right, good. Extraocular movements intact, full, and without nystagmus. Now, let me take another look at your pupils for a second. Okay, your pupils are black, circular, and about 5 millimeters in diameter. So now I'm going to dim the light, and I'm going to assess how your pupils react to lights. So I'm just going to shine my light in your eye. Do that again. All right, yeah, I can see that your pupil was constricting. Okay, yeah. So that was good. Both your pupils constricted. And when I shined it into one, the other one constricted. So that was like consensual. So now I also need you. Can you look at the tip of my pen? And I'm just gonna move it. Okay. All right. So that shows that his eyes are reacting to a combination. So his pupils were round, or his pupils are equal, round, reacted to light in the combination. In a clinical setting, I would use an ophthalmoscope to look at his eyes. The purpose of that instrument is to look at the inner structures of the eye, especially the retina. All right, so now we're gonna move to your ears. So first thing first, let me look at your ears. Okay, so his ears are symmetrical. Their tips are in line with his eyes. The skin of the ears is uniform in color with the rest of his body. There's no piercings, the skin is warm. There's no exudate, lesions, swelling, or pain. Okay. So now, I'm just going to check a few things. His ears are elastic. Do you feel any tenderness?
No.
No tenderness over the mastoid process, tragus, or auricles. So now let me take a quick look at your ear. No foreign bodies present in the ear. Can you turn your head towards me? No foreign bodies present in either one of the ears, and a small amount of cerumen present. So now I'm going to assess your vestibulocochlear nerve. So what I'm going to need you to do is, I need you to cover one of your ears. Okay, now can you turn your other ear towards me? Okay. I'm going to say a word. Did you hear that? Mm-hmm. Okay, so now I need you to cover your other ear. Did you hear that?
Mm-hmm.
Okay. So that shows that the vestibulocochlear nerve is intact. An instrument that's often used to inspect the ears is the otoscope. The purpose of the otoscope is to look at the ear canal, and it's often used to look at the tympanic membrane. All right, so now I'm going to take a look at your nose in specific. Your nose is midline and without deviation. Can you put your finger over one of your nostrils and then blow out the other? Okay, now can you do the same with the other? All right, so both the nostrils are clear and patent. Okay, now I'm going to check your front. I'm going to take the glasses again. I'm going to check your frontal and maxillary sinuses. All right. So just tell me if there's any tenderness.
No.
All right.
No.
Okay. Get your glasses back. If I was to assess cranial nerve 1 is the olfactory nerve. I would have him cover one of his nostrils, and then I would present him with a familiar smell like vanilla, and I would see if he could identify it or not. All right, so I'm gonna start the assessment of the mouth. The lips are symmetrical, pink, moist, no cracks, no lesions. That's all good. Let me take a look at the buccal mucosa. It's pink, smooth,
moist, no lesions. Teeth are present, they're white, in good repair, and no appliances. After the teeth is the gingiva. The gingiva is stippled, it's pink, it's moist, there's no lesions, no edema, no retractions, and no bleeding. Okay, then next, the hard and soft palate are continuous, smooth, with no lesions. The hard palate is white with transverse rugae. The soft palate is pinker and moist. The pharynx is pink. The tonsils are absent. There is, what's it called? No sign of swelling or exudate for the pharynx. Okay, so now I'm gonna ask you, I'm gonna put this in your mouth, and I'm gonna ask you to say ah.
Ah.
Okay, so uvula is midline, rises and falls with phonation. Okay, so next thing that I'm gonna ask you to do, or I'm gonna check your gag reflex next, okay? So I'm just gonna move it to the back. So yeah, the gag reflex is present, shows that the vagus nerve is intact. The next thing, the tongue. Can you lift your tongue for me? Okay, that's good. The dorsal side of the tongue is pink. You can let it back down if you want to. Dorsal side of the tongue is pink and rough because of the papillae. The ventral side is glistening, veins are present, and saliva is present, and it's smooth. So last thing, can you open your mouth again for me? I'm gonna push and put pressure on your tongue from the side, and you need to give me some resistance, okay? Okay, good. Now I'm gonna do it the other side. Good. Okay, and so can you stick your tongue out? Okay, good. So that shows that the hypoglossal nerve is intact. When he stuck out his tongue, it was midline. All right, so that's it for the mouth. Next is the neck. The skin of the neck is pink, continuous with the face. There is hair on the back of the neck. No scars, no lesions. So I'm gonna ask you to move your head in certain ways. Can you first move your head towards your chest? Now can you do it the opposite direction? Okay, now can you do it on the sides? Can you rotate your head? Okay, that's good. I would say that the neck has full range of motion with no audible or palpable crepitus. Next thing, I'm gonna push down on your shoulders, okay? And you need to shrug your shoulders up towards me, okay? Okay, that's good. Now, rotate your head towards my hand. I'm gonna try to give it some resistance. Good. Good, okay. So, those tests show that the trapezius and sternocleidomastoid muscles are strong. The spinal accessory nerve is intact, and the client gave good, strong, equal resistance during those movements. So next thing I'm going to do is I'm going to palpate your lymph nodes, okay? So I'm going to start with and tell me if there's any tenderness. The preauricular, the postauricular, the occipital, the submental, the mandibular, the tonsillar, the superficial cervical. We do one deep cervical at a time. The posterior cervical, and then the supraclavicular. You notice any tenderness? Okay. So now I'm going to feel your carotid pulse. Okay. All right, now I'm going to listen for breathes. When I'm listening, can you hold your breath? Heard no sign of bruise. The carotid pulses were strong and equal. Next thing. All right, so now we're going to start on the thorax and the lungs. Normally when I do this, I would start by inspecting. I would take a look at just his skin, and there's no lesions. Then I'd also palpate for tenderness over his chest. Any tenderness? Okay. Then another thing is, can you turn a little bit more towards me? Okay, so taking a look at it, his anterior posterior diameter is compared to his transverse diameter. His transverse diameter is twice his anterior posterior diameter. Also, looking at his spine, it has the S shape. Or sit up for me. Yeah, so spine has an S shape. Spine is also midline. All right, so that's it for that. So can you sit to where you can turn towards me a little bit more? Okay. So I've already palpated for tenderness, any lumps, pain. Now I'm going to check for tactile firmitus, okay? So I need you to repeat the word 99.
99.
Okay.
99. 99. 99.
Okay. So the resonance sounded the same throughout all those. Now next thing, let me find where your ribs are. Okay, so can you take a deep breath for me? Okay, chest expansion was equal. Now can you turn your back again towards me? I'm gonna try to take a listen. And just take a deep breath through your mouth. Vesicular lung sounds were present in peripheral fields. They were greater on inspiration than expiration. All right, so can you turn back to how you were before? Now I'm going to take a listen to I'm going to listen to your lateral lung sounds. All right, now this side. Okay, sounds good. Now I'm going to listen to your anterior lung sounds. All right. Deep breaths.
intrasecure lung sounds can be heard in the peripheral fields. Now, another last thing I'm going to do for your thorax and lungs is I'm going to test the Turner clavicle. I don't see any tinting. No tinting. All right. All right, so instead of doing a breast exam, I'm just going to explain to you how a breast self-examination is performed. First, you want to inspect the breast. You want to make sure that there's no bulges, lumps, or swelling. After that, you also want to look at the skin. You want to pay attention to the color. You want to make sure that it's the same as the rest of the thorax. You want to make sure there's no vascularity, striae, or lesions. The areola are usually darker than the surrounding skin. Nipples are usually everted. Also, breast symmetry is very important. You don't want any masses, no edema, no dimpling, and no retractions. Usually whenever you're doing a breast exam, you'll assume a few different positions. When inspecting them, you'll position yourself where you have your hands over your head. You'll have one where you have your hands on your hips, and then another one where you're bent over. And another thing about the breast exam is you want to check your axillary nodes. So the lymph nodes that are under your armpits, you want to assess the posterior, anterior, central, and lateral lymph nodes. When you're actually palpating your breast, you want to be laid back with one of your arms up with a pillow supporting you so that you can properly palpate your breast. And you can use 3 different methods. You can use a vertical strip method where you sweep down the breast. You can use the circular method where you make concentric circles around the nipple going outward. Or you can use the wheel spoke method where you go in towards the nipple and then out towards the nipple in sections until you've covered the whole breast. Another thing whenever you're palpating your breast is you want to palpate the nipple. You want to do this to check for any type of discharge. You also want to check to make sure there's no palpable masses, no discharge, and no dimpling. You can also just look at your nipples while you're doing this, like you don't want any scaling, bleeding, discharge, none of that. That's also good to compare them against each other for symmetry. The last thing, can you prop your feet up here? I wanted to check the capillary refill of your toes, the less than 3 seconds. I also wanted to check just your temperature. Yeah, your legs are warm, okay? And then your pedal pulse. Yeah, your pedal pulses are 3+, equal bilaterally.